Hi, everyone, and welcome back to Forethought, a podcast series dedicated to raising awareness about mental health and well-being through lived experience stories. So my name's Joel. I'll be hosting today. And before we begin, I'd just like to acknowledge that I'm recording today from the lands of the Gadigal people of the Eora Nation, and I pay my respects to elders past, present, and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of Australia. So today we have a very exciting episode, and we're joined today by Ellie Kirk, who's the clinical director here at ForMind. Ellie, how are you doing?
Yeah, not too bad, Joel. Not too bad. How are you?
I'm going very well. It's been a pretty wild week, but
Yep.
okay, and we're getting through it. So I guess to start us off, as always, would you just be able to tell the people listening just a little bit about yourself, your story to getting to where you are today, all that fun stuff?
Oh, yeah, absolutely. So, as Joel said, my name's Ellie Kirk, and I am the clinical director at ForMind. I'm also a counsellor, and I am also a beef farmer. Funnily enough, I live with my family, so 2 young kids and my husband, on a small cattle farm on Narragansett country in the Snowy Mountains region of Australia. So as you can hear, I wear lots of different hats. But how I kind of got to be a counsellor is I've always been really interested in people and their stories, and that led me into doing a PhD in sociology looking at gambling. And that was really interesting and that was great, but I kind of decided that academia was maybe not for me. And while I was sort of working around in a few health NGOs and in some government roles, I started doing my Masters of Counselling. And while I was doing that, I was also volunteering at Lifeline as a telephone crisis supporter, and really found that that was something that I really got a lot out of doing and felt like it was something that I could do. And so I decided that I'd pursue my Masters of Counselling and hopefully one day work as a counsellor. And a few years later, I did. I graduated from my Masters of Counselling in 2019. And since then, I've had a pretty wild introduction to being a counsellor. So as I said, I started kind of getting interested in counselling from working with Lifeline. And so I continued working with Lifeline right up until after I graduated. But I also worked in schools and in relationships and gambling counselling and grief and loss counselling. And in 2021, I decided that I'd open my own private practice, Let's Grow Counselling. And I also joined up with ForMind as their clinical director, sort of doing some really good, interesting work about promoting mental health in the workplace. So I hope I haven't rambled on too long, Joel, but that's kind of a little bit about who I am and how I got to be here.
No, it's very important, I think. And, we're very lucky to have you because you do have so many different, diverse, I guess, experiences from the past. And I think one of the, common challenges we see in the industry at the moment, and something that's going to be awesome to unpack with you, is really around, what do counsellors do, is sort of, like what's the counselling 101 or counselling for dummies. So it's like, there's a lot of information on the internet. There's a lot of, people with different ideas of what counsellors do and all of that. But I guess, from, the beef farmer's mouth, like what is a counsellor? What do you do? And, how does that compare maybe to what people think you do?
Okay, so one of the things to know about me is that I'm an elder millennial, and as such, I communicate through memes. So to use the meme format that was popular a few years ago with what my friends think I do, what my parents think I do, what society thinks I do, I'll run through that for counselling. So what my friends think I do is a picture of Matt Damon and Robin Williams in Good Will Hunting. And, that's kind of the one idea of counselling is, it's like these kind of heart-to-heart, deep thinking chats that you have with your mentor, which is kind of nice, but it's also not quite accurate. And then the meme kind of goes to like what my parents think I do, and it's this sort of sad-looking woman handing someone a tissue, and it is highly accurate. There is a lot of passing the tissues that happens in counselling. And one of the best pieces of advice I got was pass the tissues early and pass the tissues often. But it is a little bit more than just passing the tissues. what society thinks I do is a picture of an old-fashioned psychoanalyst with a lady lying on a couch. And I have had many couches in offices that I've worked in, but we never get clients to lie on the couch and sit behind them with a notepad making scribbles. That's a really old-fashioned, very niche kind of therapy, but it's really popularized in movies and books, this idea of psychoanalysis, and everything relates back to your mum and Oedipal complexes, and Freud has a lot to answer for, to be honest. But yeah, so that's another view on what counselling is. What my clients think I do, there's a picture of a wizard with a phoenix on fire. Not quite sure if that's what my clients think I do. You'd have to ask them. But yeah, let's park that. What I think I do is a picture of two very smug looking people in white on top of a mountain. And yeah, I don't think I do that, but I think there is kind of a bit of a helper mentality in counselling, that we like to think that we're guiding people on this journey to be their best and most radiant and, immaculately clothed selves, standing on top of a mountain going, yes, I did it. So that kind of is accurate. And then we get to the last picture in the meme, which is what I really do, which is another sad looking woman with a big stack of paperwork. And that is unfortunately very accurate, because my job has a lot of paperwork associated with it. But yeah, so I guess that's kind of just a quick way to say there are so many different ideas of what a counsellor is and does. And end of the day, what a counsellor does is they help people with problems of living. So things like grief, divorce, coming to terms with something tricky that's happened, stress, adapting to a new baby, just not feeling like you're getting what you want to out of life. So that's really what counsellors do, Joel. We help people with problems in their lives.
And I think, yeah, that's really one of the next big topics that's out there is, the difference between a psychologist and a counsellor, and, what people should see a counsellor versus a psychologist for, and all of those kinds of things. So it'd be interesting to hear from your point of view, like, what's the difference between a counsellor, a psychologist, and a psychiatrist, I guess?
Yeah, for sure. And you're totally spot on, Joel. There is a fair bit of confusion around what we each do. And I can understand that, because there's actually a whole lot of overlap, particularly between counsellors and psychologists. So counsellors, as I said, help with problems of living. So they deal with people who are going through all sorts of stuff and just need a bit of a place to talk about what's going on. Psychologists help with these things too, but they've got some different training to counsellors that helps them with diagnosing and understanding different kinds of mental health conditions. So things like depression and anxiety, PTSD, ADHD, neurodiversity, all those different things. So psychologists are like counsellors. A lot of psychologists work in talking therapies. And for a lot of people, going to see a counsellor and a psychologist is basically the same kind of an experience. But psychologists have kind of an additional skill set to counsellors based on identifying and diagnosing particular mental health conditions. And then we bring in GPs and psychiatrists. So GPs are your family doctor, and psychiatrists are doctors who've done specialised training to be psychiatrists. So extra training in the mind, the brain, and how that affects how we feel. One of the things to remember about GPs and psychiatrists is that they are the people who you go to if you need to have medication prescribed. Counsellors and psychologists cannot prescribe medication. Mm-hmm. So that can be a positive for some people and a negative for some people. If you're really feeling like you need some medication and that's the avenue you'd like to go down, you're not going to get that going to a counsellor or a psychologist. Whereas if you're concerned about, talking to someone and being put on pills because of what you've said, a counsellor or a psychologist can't do that. So there's a degree of safety there.
Yeah.
But yeah, one thing I will say about GPs and psychiatrists is that they can be really helpful in your mental health journey, even if you're seeing a counsellor or a psychologist anyway. just because they can look at your physical health and how it's impacting on your mental health. And I think a lot of the time we can really forget that a lot of physical health conditions can lead to, low mood, tiredness, feeling bad, feeling anxious. So it's a really good idea to have a good GP in your care team, just to make sure that there's nothing going on physically that is stopping you from feeling good.
That's a really interesting point. So I guess part of being a counsellor as well is if you are working through, a particular challenge with a client, you're also looking out for those signs that there might be something physical that's contributing to it, and, letting them know to go see their GP if they haven't.
Yeah, 100%. And, common things we talk to people about are like your iron levels checked, checking your thyroid. A simple blood test from the GP can really help to work out if there's something physical that's making you feel unwell, that's not helping your recovery.
Yeah. Okay, awesome. And I think, the next sort of area, and this is, I guess, a really interesting and challenging topic, and sort of, when to go and see a counsellor. And, from my own lived experience, it took me 3 months to finally go and see someone. And at that point, it was sort of, I was pretty advanced in my own journey with mental health. And so something that I always believe in is trying to get people to go and have these chats early. And it'd be interesting from your point of view as the person who I would actually come and talk to, like, when should people see a counsellor? What are the common things to see a counsellor for? Like, what would you recommend?
Yeah. So the saying that I always think of when I hear this question, and it's a really good question to ask, is the best time to plant a tree was 20 years ago. The second best time is now. Basically meaning that most people wish they'd started counselling sooner, but any time is better than putting it off.
Yeah.
Like you said, Joel, and I'm really glad you shared that, because it is a really common experience that we put off going to the counsellor, like we put off going to the dentist, because they're both painful and sometimes expensive, and we don't want to do it. But once you do it, you actually start to feel better sooner. Because counsellors are there for life problems and not when you're, quote unquote sick. It's a very much a model of care that encourages you to see a counsellor whenever you need to, particularly because you don't need a referral to see a counsellor. You can just rock up to one yourself. You can Google them. You can book them through your work's EAP program. You don't need a GP. You don't need someone to write you a letter saying, please see this client. You can just self-refer.
Mm-hmm.
You also don't have to be in a really bad way to see a counsellor. One of the things that I think is really important to know about counselling is that because our focus is on helping people with problems of living, we can help give you advice when things are just a little problem. So I often think that, a really good time to see a counsellor is when you're starting to notice that you're in a bit of a pattern and you don't like that pattern. And whether that's you're drinking a bit too much, or whether it's your gambling's getting a bit out of control, or your online shopping is not quite hitting the spot like it used to, and you're buying more and more and more to get that same good feeling. Those are the times when I think, come and see a counsellor, when you're starting to notice that pattern and you don't like where it's headed.
That's also, I guess, a really interesting thing. Something that I guess is happening maybe a bit more now than it used to be, but if you're noticing those kinds of things in one of your colleagues or in one of your friends, like, at what point would you sort of recommend, if you're listening to this and you're wondering, hey, I've been seeing my mate acting a bit kind of different the past couple of weeks, like, is it sort of, just a casual conversation, just being like, hey, I've noticed a few things, like, what would you recommend there?
Yeah, look, I always think, it's really tricky to get someone to see a counsellor if they don't want to see one. But having said that, if you can plant the seed that you're noticing things are changing, then I think that's a really good conversation to have. And as you said, casually is often a really good way to do it. You don't have to, again, Dr. Phil has done a lot to reduce the status of our profession, but you don't have to do a Dr. Phil style intervention where you get everyone together in the lounge room and, talk about your feelings. It can be as simple as, I've noticed things are a bit different for you. I care about you. do you want to tell me what's happening, or I'm here if you want to talk about it.
Yeah.
I always think a good thing to keep in mind is kind of the 2 weeks rule. So, we all have rough patches, but if you're kind of noticing that your friend is a bit off for more than 2 weeks, that's when I'd start to maybe think about saying, hey,
And that can be anything from, I guess, like looking a bit fatigued or tired, or maybe going a bit quiet, or everything in between.
Yeah, absolutely. Any kind of change that you'd notice. Obviously, we all go through changes in life, and I've recently had a baby, so I think most of my friends would say that I've been looking fatigued, which is accurate because I am fatigued. And I don't suggest you rock up to a new parent and tell them that they're looking tired, because they'll either cry or they'll
Noted.
give very, very in-depth description of the latest nappy. But you know what I mean? Like if you can't identify a reason why someone's looking really tired and withdrawn, maybe it's worth asking the question.
Yeah.
Yeah.
Awesome. So I guess that kind of is really good. Thanks for sort of giving that context. And then I guess the next thing is, you did reference Goodwill Hunting, one of my favorite movies, and sort of, is that what it's like when you're inside the room? Like, what actually happens in a counselling session, and, maybe the first one to subsequent ones, like, yeah, what happens behind the door?
Yeah. Okay. What happens behind the door? So this is, without violating any patient confidentiality, it's a surprisingly, I'm not going to say pleasant, but it's a surprisingly easy place to be in once you get there. Basically, a good counsellor, and, you'd have to ask my clients whether I'm a good counsellor or not, but a good counsellor is going to make it feel easier than you thought it would be to talk to them. So it's not quite, you're going to step into the emotional equivalent of a nice warm bath, but it is that when you're talking about some of the hardest stuff in your life, your counselling session should feel a bit easier than you thought it would. Most of the time, particularly in the early days of counselling, there's a lot of the client talking, particularly because usually you're coming to counselling with something that you want to talk about.
Yeah.
So really that first session is the counsellor listening to that story and getting to know you, and doing that kind of initial download and debrief. That most often than not is what happens in those early sessions. As times go on, your counsellor is going to start, it's going to become a bit more of a two-way street in session.
I guess it's a lot of information to download. If my first counselling session was when I was 35, like, how are you supposed to figure out everything that happened in my life in an hour?
Yeah, exactly. And not to go back to our Freudian friends on the couch, tell me about your childhood, tell me about your mother. Like there's a lot that goes on in a person's history that can contribute to what's happening for them now. So yeah, really those early stages are lots and lots and lots of getting to know the client, getting to know what's happened to them, what the present concern is, but what's happened before that, and really starting to put a framework, a bit of context around what's happened. So that's kind of how things typically go, but you're working with people, so there's never really a typical. It's kind of, it can be really varied. Sometimes some clients come to counselling and are really quiet and they literally do not know what to say or do. And then you might have a counselling session where the counsellor asks a few more questions. And that's about trying to get to know you and the nature of your problem a little bit better. So that's kind of the other side of the coin, is that sometimes our role in counselling is to really draw people out. And if you were a fly on the wall in that kind of a session, you'd hear lots and lots of questions from the counsellor. And, again, there's no right or wrong. Both are totally okay ways to go about starting your experience of counselling. And another thing that is really common that I wish people knew a bit more was that most people have some kind of a strong emotion come up in a counselling session, whether that's having a cry or getting angry about something, or just feeling really sad or frustrated, that's really normal. And they are very important. Those emotions are really important parts of dealing with a life problem.
That's really interesting. Like, why is that?
Well, I think so. If it goes to plan, right, counselling is a space where you can really start to make connections between what's happening, so the events, the emotions, and the thoughts.
Mm.
And you can really start to go, okay, well, when this happened, I felt this and I thought this, and that impacted my behaviour in that way. And if I want to behave differently in the future, then I need to identify and work on what those events, emotions, and thoughts have been.
Yeah, so it's sort of like that self-realization, I guess, where it's like when you say it out loud for the first time, you're like, oh, okay, like very interesting.
Exactly, 100%. And, you know, I think we have a really funny relationship with emotion in our society, and some emotions we're very good at sharing, like happiness and excitement and all those really feel good emotions, but the other emotions kind of sometimes get pushed aside, and counselling can be a place where those emotions we sometimes don't like to acknowledge, or we neglect, like loneliness or sadness or anxiety, can really start to have some space and time.
Yeah.
It's a really important part of the counselling space as well.
Interesting. So I guess, how long would a standard appointment go for? Roughly how many would somebody need to go through? Is it kind of different for everyone?
Look, so the amount of time a session goes for, it's almost always 1 hour, give or take 10 minutes. The reason for that is that most people get really exhausted talking about their feelings after about 45 minutes. Some people like to go for longer, but most of the time, most counsellors tend to stick to that 1 hour, just because that's when most people are ready to finish.
Yeah.
So that's a pretty easy answer, right? The second part of your question, how many sessions will you need? That is really, really tricky. I personally think that the client knows best how many sessions they need. So I think that most people coming into therapy have a better idea than they give themselves credit for about how big the problem is and about how much they're going to need to put into fixing it. So really, I think clients are the best experts to tell you that. Some therapists like to do quite a structured program of therapy. So that might be doing, one session a fortnight for 6 weeks, or, once a month for a year. And that personally, that's not how I practice. I prefer to let clients have a bit more control over when and how they come to see me. But really, it depends on you as the client. Yeah. I've had clients have really good sessions where it's 1 or 2 sessions, and they've booked in because they've had something happen and they literally just need to tell the story. And once they've told the story, they're ready to go. They've got what they need. They've got it off their chest. 1 to 2 sessions is it. Other clients I've worked with for a really long time, and we kind of dip in and out. We might have done once a fortnight for a couple of months, and then we kind of catch up once in a blue moon when the client needs to. That's something I see a lot with my grief and loss clients, that we do some pretty hard work at the beginning, and then the sessions we do are kind of when something happens that kind of makes the client go, oh, okay, I need some space to process that. I'll book a session.
Yeah, just a triggering event, like you've just heard a song on the radio or something like that. That's just causes a bit of stress.
Absolutely, absolutely. And I think that's a really healthy way of thinking about counselling too, that you can use it really intensely when something massive is going on, and then you've still got that relationship with your therapist to dip back into as you need.
Yeah. So I guess there is almost like maybe not a lifelong bond, but when you find someone that really works for you, you tend to sort of just know, right, this is a trusted person now. I'm going to keep touching base every time something stressful happens, and they're kind of like your person.
Yeah, 100%. And I really think that the goal of good counselling is that you work with a client so that 90% of the time or 99% of the time, the client's okay to manage on their own.
Yeah.
But 10%, 1%, that small fraction of time when they need someone, that you can offer them that space that is a really special space.
Yeah. No, that's really awesome. So I guess this kind of, you just almost led into the next one, which was, how do you know you're getting some kind of benefit from your counseling?
Yeah, 100%. And look, I'm probably the wrong person to ask about this. You should probably find someone who's been a counselling client, but I myself have been a counselling client as well as a counsellor. And looking at it from both sides of the fence, this is a really tough one. So what makes it tricky is that when we're talking about life problems, sometimes there's a lot of tricky stuff we need to come to terms with before we can start actually addressing the problem. So the classic one that I see a lot is that, you come to a counsellor because you're a bit worried about your drinking or your online shopping or your gambling, and you want to cut back. And then as you start to explore that kind of connection between the events, the emotions, and the thoughts, you realize that the reason you've been doing the drinking, the gambling, or the whatever it is so much is because it's a way of coping with pain from something that hasn't really been dealt with properly. And so then the task becomes, okay, so we need to address that pain, and then we can find ways of addressing that behavior that we're trying to change in conjunction with addressing that pain. So in those kind of scenarios, you may feel like you're dredging up really hard stuff before things start to get better, which is tough. But as a general rule of thumb, after a few sessions of therapy, so I'd say maybe 3 to 5, what I want to hear clients saying is that they should start to feel like their ability to cope with the life problem is getting bigger, even if the problems are the same size.
Interesting.
Yeah. So sometimes we have life problems that we can do stuff about, and sometimes we have life problems that we can't do stuff about. So we can't undo our pasts, we can't undo a terrible loss, but we can learn how to cope with them. And that's where you should be looking for a change. So
that's kind of interesting. So yeah, it's about building those strategies that sort of not wean you off, but sort of reduce the dependence on the number of counseling sessions, because you're transitioning the empowerment back to the client so that they can go forth.
Absolutely. And that's really where you get to at the end of the day. And it's funny, I've talked to quite a few people who kind of have this idea, again, kind of going back to pop culture depictions of therapy, that, you're going to see a therapist twice a week for your life, like in some kind of a Woody Allen movie. And maybe that's how New Yorkers do counselling, but most counsellors I know don't operate that way. And the goal is that you want your clients to be able to live their life on their own terms. You don't want them feeling like they need to run everything past you. You want them feeling like they are the directors of their own life.
I guess that's like, one of the other things I was going to ask you about. So in my own experience, I saw someone through an EAP a long time ago once, and just immediately knew it wasn't going to work out because of the tone of the voice or the appearance of the person. So if it's a surprise and that's the thing that throws you off, that's okay. But if you do know what your counsellor looks like before you go, and then you get to the end of the first session and you're kind of frustrated because nothing was fixed, like you didn't have a magic pill that fixed all of your problems, like that is, I imagine, quite a common feeling for a lot of people who go into counselling. It's like, I'm going to have my one session, I'm going to walk out of there and I'm going to be fixed, or all my problems will go away. Like, what do you sort of say when, I guess, that expectation is put on counsellors?
Yeah, look, that's a really tough one, isn't it? And I a big part of me wishes that we could.
Mm.
Yeah, that would be so wonderful, is if we could, someone could lay the painful thing that happened in their life out on a plate, and we could just neatly package it up and put it in the bin and it was gone. That would be fabulous. Unfortunately, we can't. But what we can do is we can start to look at, where are your strengths? What have you got in your corner that can help you handle this? What can we give you? What can we build for you that's going to help you cope with this?
Yeah.
And I think if we change the expectation from, I'm going to go to therapy and it's going to fix it, to, I'm going to go to therapy and I'm going to learn how I can fix it myself, that's where we start to get into a really good spot where we can do really nice, productive work.
Yeah, and I guess that there's a large part on education and awareness. And, it would be nice if Hollywood started depicting that in a few more movies rather than how they do it, because I guess it's probably a perception. I know for a fact it's still a perception out there that, you want to go to these things, it's like a one and done. But the way you just phrased it then is quite beautiful, I think.
Yeah. I mean, and, a one and done might, there is a possibility that there's a therapist out there who can fix your problem in one session, right? And there's some kind of unicorn therapist and they've got the magic words to say to fix it. And if you know that therapist, please give them my number. I would like to talk to them. But if that was how it happened, we'd miss out on this really valuable journey of learning how to sort things out for ourselves. And counsellors are really there to help you on that journey, to help you work out what you need to sort it out for yourself.
Yeah. No, that makes a lot of sense. Yeah, that empowerment, I think, is really important. So I guess next kind of topic or next challenge, like, what are some red flags that you should keep an eye out for if you are starting to see a counsellor? It might be your first session, or you might have had a few and you're just not quite sure. Like, what are some key watch outs?
Yeah, for sure. And, there's a strong analogy with dating, isn't there? That, if you're on your third date with someone and something just doesn't sit right, you should probably listen to that gut feeling. We can talk about red flags in a second, but I'm going to start with some green flags. So some things that are good signs in your first few counselling sessions to know that you're getting into a good spot with your therapist. So the number one thing is that your counsellor is registered with the Australian Counselling Association, so the ACA, or the Psychotherapists and Counsellors Federation of Australia, called PACFA. What having a registered counsellor means is that you know that you're getting someone who has a particular minimum standard of qualifications they have to meet and a minimum standard of ongoing professional development and supervision. So I think if you can see that your counsellor is legit and registered, it means that they take their profession seriously, and that's a really good start.
And so what's supervision for those of us who are uneducated?
It's not a question of education. I didn't know what supervision was either until I started my training. Supervision is basically therapy for therapists, where we talk about particular things about our job that are tricky for us. It could be a particular story that we've heard from a client, or it could be how we're handling our workload and our stress. And we have to do it to stay registered in Australia. You have to do a minimum of 10 sessions a year of supervision. Otherwise, you can't be registered. So it's basically a way of making sure that you don't get too big for your boots as a counsellor. Kind of keeps your head on straight. It keeps you grounded. It keeps you accountable as well. And your supervisor is normally a counsellor who has like at least 15 years of training.
Okay.
So it's basically you're kind of working with someone who's much more senior than you and who can get to know you as a clinician and start to work out, is Ellie doing the thing where she over-identifies with the client again? Need to pull her up on that. She does that all the time. So yeah, that's supervision. So
Okay, it's not like a creepy third person in the room as like you're in it.
absolutely not. No, that never happens. Never ever happens.
Very good to know.
The closest you get is the pets that join in on video calls.
Yeah.
Yeah. So another green flag is that your therapist has a university qualification. And you can ask about registration and qualifications. A good counsellor will not be offended if you ask those questions. It's a no-brainer to ask. You're engaging them as a professional. You want to make sure that these are people who have put in the time and the energy to get qualified and to be registered and to be doing all the things they need to do as a professional, to be looking after themselves and looking after you. So I think it's totally legit that you ask about that. So another green flag is they're transparent about pricing. They should be really clear on their website or when you talk to them for an initial chat about how much sessions are going to cost and how long each session goes for. And as I said before, you can't really say how many sessions you're going to need, but basically you should have no mystery at all about how much you're paying and how many minutes a session should be going for.
Yep.
Another green flag is that you feel listened to and the counsellor gives you an opportunity to correct them if they've got it wrong. That's really important because I know from being a client that I made a huge mistake with a therapist once where I let them kind of have a little misunderstanding about something and I didn't correct them. And then it kind of took the therapy off on a completely different direction that had no relevance to what I needed at the time. So a good therapist will ask you to correct them. They'll say, look, tell me if I've got this wrong, but it sounds like X, Y, Z. And you can go, actually, it's ABC. And then the therapist will go, oh, right, okay, ABC. Gotcha.
I guess they're only doing what they can with the information they're presented. So
that's it. But, a good therapist will constantly be checking in with you about whether they've got it right. And you should feel safe and secure enough with them to say, sorry, you've actually got that wrong. It's like this.
Yeah.
And the ultimate green flag that we're looking for is, like I said before, it feels easier than you thought it would to talk to them. It's never going to be completely easy, but it's going to feel easier than you thought. They should put you at ease on some level.
So almost like a mate, just like having a chat with a mate, just a really casual conversation sort of vibe.
Absolutely. And it's not the same as talking to a friend because it's not that two-way street. Counselling is a space just for the client, but it should have that same kind of ease that you have talking to someone who you can really let your guard down with. Yeah. So red flags. Okay. My big red flag for counsellors, I've got a couple. Aside from no registration and no qualifications, that's a no-brainer, is when they try to on-sell you things. So it could be a course, it could be products or other things you have to pay for. I think any counsellor who tries and on-sells is something to be really wary of.
Yeah, right.
Yeah. And I've seen it happen. It doesn't happen very often, but it does happen occasionally, and that's a big red flag.
Like candles or relaxation tapes or
yes,
something
this
like that.
Magnesium spray will help you sleep really well, and maybe it will, but it's not your job to on-sell. Yeah. Another big red flag is that you feel like you're the counsellor because the counsellor talks about their own life a lot. Some counsellors will do this a tiny bit in session, but the session is for you. It's not for the counsellor.
So the only time they might do it is to try and like give you some context, like the time I did this, and then put it all back onto you and sort of take the step back.
Yeah, exactly. It's always got to be about you. Yeah. The other one is that the counsellor tells you what to do. end of the day, this is your life, not the counsellor's, and it's not your counsellor's job to dictate what happens in your life. So if you find that a counsellor is telling you to break up with someone, or to stay in a relationship, or to stay at a workplace or quit a workplace, it's a sign that you should be looking for someone else. What a counsellor can do is get you to explore, what would it be like if the relationship with your partner was to end? It sounds like you're thinking about it. What do you think it would be like? But it's never their job to say, wow, you should dump him. Having said that, if there's a safety concern, counsellors will always work to keep you safe.
Yeah.
And if you're in a situation where you're unsafe, they will say, look, I'm really worried about your safety at work. I think you need to take some steps to protect yourself.
That makes a lot of sense as well. And I think it's quite a common thing is like, I'm going to go to this session and they're just going to be the oracle. And I'm going to say, should I leave this job or not? And they're just going to say, here, yes, no. So none of that. Don't expect that at all.
Don't expect that. Instead, expect questions about what would it be like if you stayed? What would it be like if you left? How could we make that scenario work for you?
And I guess that's the importance of then like the staggered sessions of a week or 2 weeks is almost like that mental homework where it's sort of like, okay, now go and run these hypotheticals or whatever it is and think about it and come back and let's touch base.
Exactly. Or, you've identified that if you're going to stay in this job, you're going to need to have some better boundaries. How did you go this week setting boundaries? Does it feel like this job could be a viable option for you if you've got no emails after 6 p.m.?
Yeah. So if you went to your boss and said, hey, I let my boss know that I didn't want to do anything at night because I want to, watch Survivor with my partner, and they've made you do it, then you kind of allow the person to answer the question for themselves almost.
Exactly. And it goes back to that thing of empowerment, right? Mm-hmm. Sometimes you have a very strong idea about what a client needs to do and you're looking at them going, my God.
Figure it out.
Yeah. Or if you were my friend, I'd be saying, dump his ass. Yeah. But you're not their friend, you're their counsellor. So a counsellor should never, ever say that to you, ever. Yeah. And the last red flag that can sometimes pop up is, we've all got worldviews. We all have ideas about politics or religion or gender relations or how to parent, all these different things. And your counsellor is no different. So they've got a particular worldview and that's fine. But when it becomes a problem is when the counsellor shares their particular worldview with you and there's no space for your version. So let's imagine that you are a new parent and you're talking to a counsellor about how hard you're finding having a baby, and that counsellor has a really strong idea about attachment parenting and says to you, you know what, you need to be co-sleeping with that baby, you need to be breastfeeding, you need to have them skin to skin all the time, and if you're not doing that, then that's bad. That's a red flag. Okay? No matter how strongly someone holds a particular worldview as a counsellor, again, it's always about the client. It's never about imposing your worldview on the client about what needs to happen in their life, because end of the day, that session finishes, you as the counsellor move on with the rest of your day, the client has to stay in their life. So it really has to be what's going to work for them.
Yeah, I guess that's kind of, the next natural point is like, how do you choose a really good therapist or counselor for you? And, I guess the second part of that is how do you move on and it's time to find someone else? Like, what are the key things to go through when you do your due diligence about going to have a chat with Ellie, for example?
Yeah, for sure. So I think most therapists nowadays have a website. So like Google them. Read their website, have a look at what they're putting out there about themselves. Get a bit of a feel for the way that they write, the way that they talk, the types of therapy that they talk about doing. Do just, 10 minutes of Googling to see what kind of a person is this therapist presenting to the world. So that's kind of your before session. In session, if you're feeling like you're not being listened to, if you're feeling like this person doesn't have an ability to understand a little bit of what your life is like, then that's probably a time to go, you know what, I'm not clicking with this person and I need to find a different therapist. And end of the day, counselling is a really personal service. And so much of it is about connection and fit, which is why on ForeMind we let you look through all the counsellor profiles so you can have a look at who might be a good option for you. And sometimes there are some things that we just aren't comfortable talking about with someone who's of the opposite gender or is of a particular age or cultural background. Like, we sometimes just need to have someone who understands a little bit what it's like to be, you know, male, female, old, young, you know, someone who on the surface has something in common with us.
Yeah.
And you should never feel ashamed about that. That's okay. Having said that, you can have a really great therapeutic relationship with someone of the, you know, who's quite different to you, but who can understand what it feels like to be in your shoes.
Yeah. So I guess coming back to this, you know, once you've found someone, it's okay to sort of at the end of it be like, that wasn't right for me, I'm going to go find someone else. Like, you're not going to meet everyone's cup of tea, and that's perfectly fine, right?
Absolutely. And that doesn't mean that you're a bad client. It doesn't mean that therapist's a bad therapist. It just means that you weren't the right people for each other. And you should never be deterred by a therapy session where there's just not a good fit.
Yeah.
It's not a sign that counselling's not for you. It's a sign that that counsellor was not a good fit for you.
Yeah, and I guess that's super important as well when we're talking about regular sessions and building these strategies. Like, if this person's going to be in your life for the next 12 weeks,
and
it feels like it's going to be more like effort, or you're sort of feeling like to yourself, like, oh, I've got to go chat to Ellie again in an hour. Like, that's probably a telltale sign that you're with the wrong person, isn't it?
Yeah, absolutely. Absolutely.
Like, almost, yeah, your like dating analogy is right. It should be like, yeah, go chat to, you know, Ellie again, or whatever it is. Like, I had such a good time last time and I've been working on this stuff, and that's the kind of response we're looking for.
Yeah, exactly. And, you know, I think it should also too, it should always feel safe to talk to your counsellor. You should never feel, you might feel nervous before a session, you might feel apprehensive, but it should always, at the end of the day, feel like you're nervous because of the content of what you want to talk about, not you're nervous because of the person who you're talking about it with.
Yeah. And I guess, you know, that you're 100% right. It is a safe place. Like, you can talk about, you know, pretty much anything. And there's no judgment, like, and so that's how, you know, you found a really good person. If you say something you think is going to shock them or make them run away, and they sort of just stay there and might pass you a tissue or sort of just nod or whatever.
Yep, absolutely. And, you know, it's probably really important to talk about that too. Hey, that fear that whatever I'm going to tell them is going to shock or embarrass the counsellor. And it is so unlikely that you will be able to shock or embarrass a counsellor. I almost guarantee you that they will have heard something far worse. And even if what you're telling them is the worst thing they've ever heard, they are professionally trained to cope with it. So don't ever feel like you're burdening the counsellor or they're going to think badly of you. Part of our professional training is about how to be able to hold those tricky things, those really hard things to hear, and to be able to control our own reactions to those things. So really, you should be able to say to your counsellor whatever it is on your mind and not feel as though they're going to come at you with a, well, that was bad, wasn't it? That was wrong. You shouldn't have done that.
Yeah. Classic mum or dad chat.
Yeah, exactly. Exactly.
So they're more like the fun auntie.
Yeah, exactly. The one who wears a lot of beads and smells strangely of patchouli at all times. Yeah, that's the counsellor brethren. But yeah, no, it should feel like someone who's kind of alongside you rather than judging you from on high.
You're in this space, you've been in it for a while now. Like, if you go back 10 years to 10 years ago, Ellie, like, what's the big piece of advice when it comes to potentially seeking therapy or a counsellor, what would you take back and let previous 10 years ago Ellie know?
Oh, that's interesting. If I'm speaking to her as a future counsellor or as a therapy client, what do you reckon, Joel?
I can as a therapy client.
Therapy client. Okay. So 10 years ago, I would probably say, don't waste your or the therapist's time by skirting around the difficult stuff. Like just go in there, just say it, just say the thing. I think
what's the rationale for that? Is because it kind of like you could waste a few sessions and at that point realize not enough has happened and go to someone else or stop altogether. Like what?
Well, I think it's more that, if you're going to be in therapy and you know why you're going, you need to be upfront with the therapist about that. And I was a terrible therapy client because I wasn't. I was not upfront about what I knew was the real burning issue. And I kind of talked about the stuff that was on the surface rather than the stuff that was the real deep down stuff. It was only when I was brave enough to actually kind of tell the truth really in therapy and say, this is actually what the burning question is, that I started to get the most out of therapy.
Yeah, right.
So that would probably be my advice to 10 years ago, Ellie, is, just be authentic in therapy. You don't have to avoid the tough thing that's going on. You can talk about the tough thing.
And I guess, that's once again comes down to the counsellor, right? If you say, get in there and you don't even say, how's your day going? And you just say, this thing's happened.
Yeah.
They're going to be able to then ask you the questions around that to get to it.
Yeah.
Vice versa. Like they can, if you don't say enough, and they're just going to be prodding you to try and get to the big thing. So there's nothing really to lose by just going in hard, I guess.
That's it. And, I think sometimes I know from myself as the times when I've been a client, I really understand that sense of, if I tell the therapist this, they're going to think I'm a loser. And they're not. I guarantee you they're not. They're going to work with you on how to feel better about it. And if you don't tell them, they aren't going to be able to work it out.
Yeah. I think that's really useful and something that, we've come a long way in the past 10 years around that stigma and, calling up and seeking help. But I think, things are improving, and, having awesome counsellors out there like yourself are definitely a way to keep us going in that direction. The stigma part of it, I think, if people have listened to this and have any more questions, like feel free to reach out to us, like either Ellie or myself. You can contact us, me at joel@formind.com.au. Where can people find more information about you, Ellie?
So the best place to go is probably my website, which is letsgrowcounselling.com.au. Or if you just Google Let's Grow Counselling Ellie Kirk, you should be able to find me. Or you can chuck me an email, and my email address is Ellie Kirk, ELLIEKIRK @letsgrowcounselling.com.au.
Awesome. And I'll put that information in the notes section for this podcast of this episode. But Ellie, thank you very much for joining us today. And I hope everyone listening found that interesting and helpful. And until next time, goodbye for now.